Hi, everybody. Good evening, and thank you very much for joining us for this webinar about LPG endermology. My name is Alice Hart-Davis. I'm a journalist and founder of the Tweakments Guide, and I'm hosting the webinar with three brilliant aesthetic experts to give you a really good overview of what this extraordinary technology can do. Now, this evening, we've got Dr. Yannis Alexandrides, who's a globally renowned plastic surgeon. We have Dr. Sam Robson, an aesthetic doctor and medical director of Temple Clinic in Aberdeen, and nurse practitioner Michelle McLean, who is another highly experienced aesthetic practitioner who leads Aesthetically in Liverpool. Now, what we're talking about is LPG endermology and specifically the new Cellu M6 Alliance device. Now, I know most of you who are joining us are already familiar with LPG and endermology offerings, but just in case you're not, or in case you remember endermology as it was 20 years ago, which is how I remembered it, can I just say that with the current technology, it is a really different proposition. I mean, yes, it's still terrific at body contouring and smoothing cellulite, but it has a great deal more to offer. You know, it's got this top-to-toe mechanical massage, it's got lymphatic drainage, it does skin stimulation, it's fabulous on the face as well as the body. So to kick off this evening, I'd like to start by asking each of our speakers a bit about why they brought LPG endermology into their clinic, how it fits with their practice and what they use it for. And then we'll get into some more general questions. And then at the end, if we've got time, because I want to keep this quite tight, I want to keep this to half an hour, then we'll have some questions from you guys. So if you've got questions, put them into the chat and we will take those when we come to the end. So Yannis, could I ask you to kick off first and say a bit about, you know, why you've got LPG endermology and how it works with what you do?
Absolutely, Alice. First of all, thank you for the invitation to this very interesting forum. For me, LPG has become a crucial part of my before and after surgery treatment to my patients. In my clinic, we perform a lot of facial surgery, including facelifts and neck lifts, blepharoplasties, buccal fat removal, and liposuction. But we also perform a lot of body surgery, such as liposuction and high-definition liposuction. So the aftercare is crucial in order to maintain and improve results. And I have found that with a lot of patients who did not follow up all the instructions I would give them, sometimes the recovery will be slow. And LPG gave us a methodology on how to prepare patients for surgery and how to help them in the postoperative period heal faster and better. And in regards to body surgery, especially with liposuction, it's very crucial to see how an early mobilization of fluids facilitates the swelling and also the bruising, so it improves recovery and minimizes downtime for patients. And long term, it improves, in my opinion, the results as well, as problems such as micro lumps and contour irregularities are diminished significantly. The same I can say for facelifts, as a lot of patients have a diminished lymphatic flow, and that can compromise both the result, but also sometimes predispose patients to problems of healing. So in our clinic, we like to prepare our patients at least 2 weeks before surgery with 2 sessions of LPG and continue the treatment for 4 to 6 weeks after the surgery.
Wow. Thank you. That's completely fascinating. I had imagined it would be great with lipo, but I hadn't thought of it all through with the face stuff. Okay, we'll talk a bit more about that in a bit. But now, Sam, could you say what you use it for? Because you use it for a very different reason, don't you?
Yes, I do. If you can put the slides up, then I can talk you through showing how we use the program, how we use LPG in my clinic.
Good evening.
Right. I'm Sam Robson. I'm the medical director of Temple Clinic in Aberdeen, and one of the programs we run in our clinic...
I'm Dr. Sam Robson and the medical director of Temple Clinic in Aberdeen.
How bizarre.
One of the programs is weight. So I shall focus on that application, weight management and lifestyle program. And within that, we use LPG to enhance body contouring whilst our patients lose weight. So I shall focus on that application of LPG. But first, of Temple Clinic in Aberdeen. One of the programs we run in our clinic is Temple V, an innovative weight management and lifestyle program. And within that, we use LPG to enhance body contouring whilst our patients lose weight. So I shall focus on that application of LPG. But first, a little bit about the lymphatic system, since many of LPG's benefits are mediated through that little understood system. The best and simplest way of envisaging our lymphatics is that they comprise the body's drainage system. This is widely distributed throughout the body with many miles of specialised capillaries, and the smooth muscle in the capillary walls promotes active pumping of lymphatic fluid. So what does our lymphatic system do? Our lymphatic system scavenges stuff that our bodies want to get rid of or combat, and it comprises part of our immune system. One of the things it can efficiently dispose of is mobilised and unwanted fat cells. As I said, we use LPG to help our weight-losing patients to recontour their bodies, especially in the areas that they are keen to lose weight from. Our patients are not only very satisfied with the results, but there is also supporting evidence. Both studies here are looking at the effects of LPG on cellulite and almost found the reductions in fat, as measured by calipers, and thigh circumference as a side effect. These are both small studies but well designed. So when we use LPG on our weight loss patients, the theory would be that the treatment mobilises and disrupts the fat cells in the areas where unwanted fat tissue remains, and then the fat cells and associated debris are massaged away during the LPG treatments, stimulating lymphatic drainage. That is how I have effectively used LPG over the past 10 years. We are now starting to explore how we can use this technology for other indications. Thank you.
Thank you, Sam. Lovely to have that there, even though I know you are there for real too. And now, Michelle, can I ask you to say a few words about how you're using LPG endomology in your practice and what you're seeing with it?
Yeah, of course. So, thank you, Alice. I have a CQC medical aesthetic clinic in Liverpool, Robson Street.
Sorry to interrupt, Michelle. You're a bit faint. Could you come a bit closer to the speaker?
Yes. Is that any better?
Yes, fantastic.
Yeah, hi Alice. So yeah, I've got a CQC registered good rated medical clinic in Robson Street in Liverpool city centre. We've got a really wide portfolio of treatments that we offer for patients, ranging from injectables, threads, CO2, Femilift for stress incontinence, female health, sculpture, fat reduction, hydrofacial, M-face, morphosate, and many, many more. But as a CQC clinic, we're always looking at how we can improve the needs of our patients, how we can bridge any gaps, and how we can improve the patient journey. And we really look closely at holistically at our patients, include their psychosocial well-being, and a real emphasis on wellness. And it was through looking at wellness and having good rapport with our patients that we discovered that a real number of our patients were suffering with fibromyalgia. And the condition itself can be really debilitating. Treatment options are limited. The main symptom of fibromyalgia is intense, diffuse pain, and it has a real impact and a huge impact on their quality of life. And initially I opted for the CellUM6 LPG Alliance device because I knew it was fantastic for lymphatic drainage and cellulite, breaking down fibrosis tissue, reducing edema, also reducing the diameter of body contours. And our patients wanted something that would really, really make a difference for cellulite. But when I found out the difference it could make to our fibromyalgia patients, I was completely sold with this. It's been really, really popular in clinic. It helps our fibro patients by relaxing the central nervous system. This helps to close the nerve pain gateway. It reduces relief, it improves anxiety. This in turn reduces muscle tension, it improves the sleep, and it has a real impact on improving the quality of life. So we've been absolutely delighted with the results that we're achieving, not just with cellulite, but also for the wellness of our patients, in particular the fibromyalgia patients, which suffer with a lifelong condition. And being able to offer a treatment to those patients has been really, really fantastic.
Yeah. Wow, fantastic. That's really great to hear. I think we'll come back to that in a sec. I wanted to ask about how easy it is to persuade patients to try endermology treatment if they're not familiar with it. And I wondered, Yannis, if I could ask you to speak about how you persuade people that it's a really good idea to have it before and after surgery on the body and the face. Because I know when we were chatting beforehand, you said you would like to make it compulsory for all your surgical patients, whatever treatment they were having, because it can bring such benefits. But is it easy to persuade them?
Well, we use our chance to educate patients during the consultation process, and the consultation process starts with me, but it continues with my patient advisors and my nurses. And by the time we explain all the benefits and how we have created these protocols for specific surgeries, most patients who have the time, and I have to say in our days there are patients, unfortunately, with not a lot of time that cannot enlist to these protocols, but the ones who do have the time are really, really easy to turn around and really go for it. It's not the only thing we offer, obviously. So this is a program that includes other things, such as using our serum, using LED light, and according to each patient, we can customize the treatment. So it's part of a program of things that we offer, and we feel that by offering these, we improve the service to the patients. Most of the patients appreciate that, because often we see clinics where after surgery the follow-up is not so attentive, and a lot of problems arise in plastic surgery when you miss things in the first few days after surgery.
Okay, how interesting. Thank you. Because I think if somebody said to me that here's something that I can promise you will make your results even better, and here are before and afters of the kind of results you get, I think I would jump in if I possibly could. And when it comes to investing in a device like this, Michelle, what can I ask you this? What persuaded you to invest in the new CelluM6 Alliance to bring it into clinic in the first place? Was it just for the lymphatic drainage and wellness? Was that your main motivator? Or is it because it's got kind of new patents and all these extra things with it?
Yeah, it's definitely the new patents that really drew me to the device itself. But I like the idea that patients, they can come in on a regular basis. It's comfortable. There's no pain. The treatment is easy. It's relaxing. It's cost effective. And the results that you can achieve with it are absolutely incredible. And patients love the treatment. It's such a mood enhancer. It makes a difference to their overall well-being and health by stimulating the lymphatic drainage. That for me, obviously we went through it predominantly for cellulite, but then realising all the other extras that you can do with this, combining it with other modalities to yield better results with those. I didn't realise at first, but we're absolutely elated with what we can do with it, and the results that we can achieve with other platforms have been so much more robust from utilising LPG alongside those.
Oh, brilliant! Yeah, and I know what you mean, because when I knew LPG and endermology from way back, and was just absolutely blown away when they got me in early this year to try it out, saying, give it a go. It is different because it's like a deep tissue body massage, isn't it? And yet it does something to your mind, calming it down, that whole sort of bringing down the central nervous system stuff, plus all the lymph drainage. Your genes go on so easily. And I just went out thinking, wow, this is really quite something. And that's on a person who wasn't looking for anything other than a just exploratory look. So I can quite understand. Now, Sam, you're using the endermology is a very particular sort of part of your whole weight loss and body contouring protocol. Do you use, when you're using the machine, are you using personalized protocols with that, or are they the ones that are already integrated into the device?
That's a very interesting question, Alice. We use a combination we use a slimming protocol more than anything else, but it's personalized to each individual person. I found moving on to the Cellio M6 from our previous LPG machine was just like turning a light on. You know, the results are so much better with the modern device. I used to have an older device, and what we're achieving with this new device is just much better. I totally echo what Michelle has said about it being a comfortable treatment. My patients come in on a weekly basis and have the endermology, and they positively look forward to it, seeing it as a relaxing massage. For me, overseeing the weight loss program, it's actually it's very valuable to bring patients in on a weekly basis, because I need to check that they're fit and well, and
Yeah.
basically provide them with the support and coaching which you need to keep you on track with a weight loss program. So although for the patients they feel it's, oh, I'm coming in for my treatment, they're actually getting the supervision and the coaching and the support, and most of them leave feeling much heavier. I don't mean much heavier.
Lighter.
Much lighter. Yes, but much happier and lighter. Sorry, that
Oh,
came
okay.
completely wrong. But if that makes sense.
Thank you. I absolutely. I think that's going to answer part of the next question as well, which I was going to say: do your do your patients enjoy Cellio M6 Alliance? You know, which they clearly do. So, like you say, it's coming back not so much for a treatment, but as having something done to them as a lovely beneficial thing. Would that be fair to say?
Yes. Yeah, Alice, I totally agree with that. That, you know, for people who have to come in on a weekly basis, that could be quite a thought if the treatment wasn't so pleasant. So it's almost as a kind of a side effect that they have. The patients are so focused on the treatment that they perhaps subliminally take on board the coaching and the support and think, oh, well, I just came for my treatment.
Okay, so and so it keeps them accountable as well, I dare say. Yeah.
Yes. For sure.
That's helpful. Michelle, your patients clearly enjoy it as well, don't they?
Yeah, they really do, Alice. And at the moment, similar to what Sam was saying then, we've been combining it, with our sculptural patients, which is lipolysis that heats the skin up to 42 degrees. But for our patients, we've been educating them if they come in and they have 1 to 2 sessions of LPG, let's break down that fibrous tissue. The fat then becomes more responsive, and we will get better clinical outcomes then. And patients are actually seeing that using this alongside other modalities does give more efficacy, it gives better results, and it means that the treatment also is more tolerated, breaking up the fibrous tissue when patients first come in. It can feel a little bit pinchy, but once we start breaking down the tissue, the treatment does become even more comfortable. And I think patients can feel it as well as see it as well. And I'm finding that even when they've tried it in combination, for instance, with sculpture or Neo-M Sculpt, they want to come in and they want to do another course of LPG just to keep the fibrosis tissue nice and soft, reducing chips, improve lymphatic drainage, edema.
Yeah, so it's not a hard thing to sell.
No, not at all. I think it's just about educating your patients. I think when they really listen to you, and once they've tried it and it does improve wellness, it's an easy treatment to do.
Yeah, fab, thank you. Yannis, for you, is there a particular patient type, like age, purchasing power, you know, who are most likely to be keen to try endermology, or is it just anybody who's already in for an appropriate procedure? I'm wondering if one type of patient goes for it more than another.
Well, from what I see in the clinic, all types of patients really like the treatment. I have to agree with the other speakers that a lot of patients find this treatment so pleasant that they want to continue, and often they continue after they have healed from the surgery as an ongoing treatment. It has a soothing ability. We have discussed this with my nurses who perform the treatment. In our practice, it's a little different though, because sometimes you have to decide when exactly to start the treatment, because sometimes immediately after surgery, it could be a little sensitive. However, I've been pushing to start the treatment as soon as possible after surgery, because I believe that's when you need it the most. And right now, our average time after liposuction is around 5 days, post-operatively. But preferably, we'd like to start around day 2 or 3 when you have maximum.
Okay.
Yeah.
I wonder if it's worth asking if we can get a couple of the slides up on screen that show the sort of difference that endermology can make after lipo. I know these aren't your work; these are endermology slides, but it would be interesting to see those. And the other thing I was going to ask while those are up was when you're using it, when your nurses are using it to work on the face, because I'm really curious about the whole way it stimulates collagen within the skin and can work on scar tissue. And how soon can you start working on the face after surgery? Because if you'd been a surgical patient, I think you'd be quite anxious maybe about having that kind of work done.
Yes, and I think that's where having different programs and different intensity comes very handy, because we start on a very low level with facelifts. And if there are specific reasons where I believe the treatment should be delayed, I of course do that. With facelifts, I really like to start on postoperative day 7. I believe by that time you have the initial healing that you wouldn't compromise blood supply. And on the contrary, I think that the early stimulation, as we saw before, what are the benefits of lymphatic drainage with LPG is the intensity of drainage of all particles that are toxic and enhanced circulation on the skin. Well, after surgery, there is an increased necessity for this. And actually, because of surgery, the lymphatic system sometimes is compromised as well. So in my opinion, that's 2 reasons more in order to start using lymphatic drainage as an LPG. So the answer is 7 days, but of course I stay very close to my facelift patients. I see them very often, and if I have to change that, I do. And we work together with my nurse, who is very experienced now in this treatment. And she's not with me today, unfortunately, because she's busy with some patients, but I know that she loves doing this treatment, and she's the one who eventually will be performing it and staying close with these patients. And her feedback is very positive.
Oh, wonderful. Because it's I've only tried a tiny bit of it on the face, but it's like being kind of nibbled by a little mechanical fish or something, the way the head moves across the face. But it's not unpleasant. So I can quite understand why she likes using it, why the patients like having it. Thank you for having those slides up. I think that's really, really helpful to see. Now, I wanted to ask maybe Michelle, let me pick on you for this one, about ways that you're using the technology that you wouldn't have expected, because you mentioned at the beginning about how useful it's been for your fibromyalgia patients, but you can't have imagined that when you brought it into clinic, or did you?
Well, when we initially had the training and my therapists, there's a protocol for fibromyalgia within that. So it was only when we realised we've purchased the machine for lymphatic drainage and for cellulite, but I don't think we realised the medical benefits that the machine can also offer. So it was only then when we started then speaking to our patients who are suffering, and we know them very, very well because we've got a good rapport with them, that we realised actually we've got a treatment here and a modality that we can actually try. So we tried it with the patients, and just the feedback and the response and the relief, the muscle tension relief, and the difference in their pain was just really, really fantastic. And it's something that they're coming in regular and having, but because it's cost effective, it's comfortable, it improves their well-being, their anxiety, their insomnia, their muscle fatigue.
Wow.
They can come in and obviously fibromyalgia have close patient groups as well. So they're telling also that people within their community who are also suffering. So we're finding getting quite a lot of patients now attending.
Yeah.
Which we didn't expect.
That is fab to hear. And question for everybody, really. I don't know, Sam, if you want to go first, then Yannis. And have you seen an increase in the activity and sort of turnover in business terms from having the CelluM6 in your practice?
Yes, the simple answer to that, Alice, is yes, I certainly have. I mean, yes, as I mentioned, it's part of our weight loss program. But we find a lot of people coming over from the continent who are more familiar with LPG are quite delighted to discover that there's a clinic that's got the service. It's
Yes.
it's not that well known in this country, it seems. So
Yeah.
Oh, you're frozen.
From
Yeah.
Can you hear me?
I can. Yes, you're back.
I'm back. Okay. Yeah, but people from Europe are much more familiar with using LPG. I think what's particularly interested me is the number of people who aren't part of a weight loss program, but just are coming for body contouring because they've heard of LPG. And
Yeah.
increasingly, we're wanting to explore some of the facial benefits, and exactly as Michelle has been saying about some of the medical benefits. I didn't know when I bought the machine that it could do all these things. And the thought that it can improve scarring and fibromyalgia, that it's a little bit mind-blowing to think it's all contained in one device.
Yeah, I was amazed by the scarring, but I gather that was one of the original uses for it. But just like you say, until you are able to explore that whole range of things it can offer, I see we're getting dangerously close up to time. So I might just move on to asking each of you in turn. Do you have one piece of advice for practitioners who might be taking on or considering taking on endermology and the CelluM6? Yannis, would you have a suggestion first?
Sure. I think I will address probably surgeons in the audience or people who perform surgery in general. I think it's a great tool to have, and we started 3 years ago, a little over 3 years ago, predominantly because a lot of our liposuction patients would not follow all the instructions, and we would ask them to do lymphatic drainage massage. Some of them would find a place to do it, some others wouldn't. So we made this decision to start having this service in-house. It has changed our practice. It has added value to the treatments we offer. Patients appreciate that. They come back. And we can see them more often, we can anticipate problems, we can prevent problems, and the results are better. So I would be glad to share more experiences with that. And gradually we have expanded its use. So we didn't start using it for face immediately. It was after a while we got comfortable with its application and how to use it when we expanded to the face. So start with something that you feel very comfortable with, and then expand from there as you get more experience.
Brilliant, thank you. Michelle, what do you reckon? What would you advise to practitioners thinking of taking this on?
I would say if there's any practitioners out there that are looking for treatments that can improve the wellness of their patients, obviously we know it's amazing for cellulite. If you've got any patients that, like I spoke about fibromyalgia, combining it with other treatments to yield even better results. And I've only just we've had ours for 12 months and we've only just touched the surface of what it can do. There's so many more protocols and medical conditions that, endometriosis, lymphedema, utilising it with fillers to yield better results and better circulation of the skin and improve the hyaluronic acid of the skin. I think there's lots of things that this machine can do. And I think for anyone looking at wellness, cellulite, want to incorporate it with all the modalities to seek better results, it's definitely something that they should look at.
Yeah, thank you. And side question, do you find you're practicing on each other in the clinic just to sort of have a go and see what you can try out and how it works before you unleash it on the patients? It must be very tempting.
Yeah, I now and again suffer with IBS, and there's actually a protocol for IBS on there, believe it or not. So sometimes if I get stressed, it's got an IBS protocol and it really works. 30 minutes. It really works.
So is that on the stomach directly?
Yes.
Wow. Okay, I tried a snippet of stomach massage when we were filming a few weeks ago, and it was fascinating because it felt firm but kind, if that makes sense. It's a sort of exploratory movement. Yeah. It's not like one of those things that gets in and grabs you too hard on the inside.
Yeah, no, not at all. It did make a difference. So I think there's a lot that this machine can offer.
Wow. Okay. And Sam, for the final word, your advice to other practitioners.
I think I would, if you were thinking about getting one, I would certainly investigate all the training that's available. I would look into the research. I would look at the protocols. Exactly as Michelle has said, there are so many different applications of this machine. And I think speak to other practitioners who've got one. speak to the company, who would be more than happy to provide you with more training, specialized teaching. You know, they're very supportive, very helpful, and certainly provide the backup that you would need if you were prepared to invest in a machine. I'd also look at some of the before and after pictures and look at patient testimonials. You know, for everything you get with that machine, it really is a good investment.
Yeah. Thank you, Sam. And yeah, great to know that the company is there with the backup, because I can see if you've got this extraordinary new device, it's all very well seeing that it can do this, it can do that, but you want a bit of reassurance about how you're going to find your way with new protocols on it. Well, thank you so much to all of you. Thank you to everybody who has joined us. Thank you, Yannis. Thank you, Sam. Thank you, Michelle. It's an absolute education crammed into 30 tight minutes. So I think this will be available for people to watch back afterwards. And I hope all of you who've watched it have found this useful. And any questions you can follow up with LPG. They'll be delighted to hear from you. Thanks, everybody. Bye-bye now.
Thank you so much. Bye.